All right, well, some are calling this sort of a damn the torpedoes move, power ahead on health care. As Democrats leave the summit behind and take a big gamble, here is Nancy Pelosi defending this move. Take a look.
Know that this will take courage. It took courage to pass Social Security, it took courage to pass Medicare, and many of the same forces that were at work decades ago are at work again against this bill. But the American people need it. Why are we here? We're not here just to self-perpetuate our service in Congress. We're here to do the job for the American people, to get them results that gives them not only health security, but economic security.
Bob Beckel joins us. He is a professor of advanced political studies at George Washington University and a Fox News contributor. And Kate Obenshain is a former chairwoman of the Republican Party of Virginia and a vice president, I should say, of the Young America's Foundation. Welcome to both of you. Good to see you both on this Monday morning. Bob, Nancy Pelosi says, damn the torpedoes and power ahead.
Yeah, well, you know, and she's right. I mean, there are going to be some people who probably lose their seats because of this vote if they vote yes. But I'll tell you, she's also right. If you look at the history of this, Medicare and Medicaid, when they were brought up, the Republicans attacked it viciously. It passed because the Democrats had such a majority, but the polls showed that people didn't want it. They didn't have polls when Social Security were passed, but my guess is that it was also editorials were negative on it. It was called socialism then. Medicare was called socialism, and now we hear it again. So I think, you know, history's right. She's right about it. And I think in time it's going to prove to be as popular as Social Security is today.
Yeah, well, you know, I think a lot of people would maybe take some issue with how those programs have turned out. Yeah. And some of those people are pointing the finger at healthcare for the same reasons, Kate. Is that right?
Yeah, they did a bang-up job going around the will of the American people for Medicaid and Social Security. Now look at where we are. Look, Nancy Pelosi says it will take courage to go around to thwart the will of the people, that they have the benefit of witnessing what the will was in Massachusetts, Virginia, and New Jersey, as we hear repeatedly. Nancy Pelosi is arguably one of the most powerful speakers of the House, and she will bear responsibility for ramming this down the throats of many of her members who actually know better. If Stu Pack and his crew come along and support it, that will be, I think, damning for them. But she's got a tough row to hoe because she's lost, we just heard a minute ago, she's lost at least three members of her coalition who supported it. She has to get the Blue Dogs on board. Right now, she does not have the votes to go around the will.
You wonder, Bob, if you're going to see some of those clips that we just looked at used in November campaigns as people try to align Nancy Pelosi and her views with this, with congressmen and congresswomen who go along with her on this.
You can guarantee you're going to see those in ads. I used to make ads in campaigns, and frankly on Social Security mostly. But by the way, Kate, I don't know if this means you're against Social Security and Medicare, but I didn't quite hear you right.
I'm certainly against the fact they're defunct right now. I'm certainly against them bankrupting the United States of America.
Okay. That's what I wanted to hear what you said about it.
On the question about the votes, about that.
The reason I think they got the votes in the House or will have the votes is a number of House members who voted no on the bill are retiring. And now they don't have to worry about the politics of it, and they can change their votes. Secondly, because you have fewer House members now, because of this retirement in Georgia and the one in Hawaii, the votes don't have to be 418 this time.
Yeah, you know what, I want to stay with Bob for a second and then go back to Kate. Lamar Alexander was just on, and Bill was speaking with him, and he basically said, again, as has been said many times, let's start over. You know, and why is there shame in that, Bob? Why not throw out that big fat bill that sat in front of Eric Cantor that the president pointed to? Why not throw it out? Because wouldn't both sides really benefit? Wouldn't Democrats benefit also if they sat down at the table and said, we worked this out together, and we really do think this is a good deal for the American people?
Well, but first of all, we do think it's a good deal for the American people. Secondly, Lamar Alexander, you know, he used to be a guy that, frankly, I respected a lot, but he's become a kind of a hitman on this for the Republicans. I don't know why, but he is. Cantor is just Cantor. I mean, he's a right-winger, and that's what you expect out of him. But having said that, look, in the end, 85% of this bill that we got out of that summit, 85% they agree on, the Republicans and Democrats. So the question is fundamentally, yes, 85% of the bill they agree on. Now, they don't agree on is the Republicans' bill. The Republicans want to cover 3 million uninsured people. Democrats, 30 million people.
All right,
and so
Kate,
the Republicans want to go that route.
I'm going to get the last word. Go ahead.
Look, Bob, the American people do not believe in 1/6 of the American economy being taken over by the government. They do not agree with 85% of this bill. What they need to look at, what the Democrats need to look at, is some of the reasonable suggestions that were brought forward last week by Paul Ryan, by Lamar Alexander. But they're not going to do that because this is an ideological bill driven by an ideological president with a determination to take over a massive quadrant of the American economy. And you're going to lose your majority. Bob, go
wait a second.
for it.
What is ideological is to say that this is a government takeover of health care. That
is not
pure,
ideological.
Absolute,
it is actual
incredible
fact, Bob. Because you know there's
extortion
going to be a panel.
And it's amazing you would extort them. You usually don't do that, but you did.
Thanks, you guys.
Bob, you know that there will be a takeover because government health care will undercut private health insurance.
All right, we got to go, guys. Thank you very much. Kate Obenshain and Bob Beckel shaking his head, and we'll see him back here very soon.
Oh,
Thanks,
took
Bob.
out his earpiece.
Took out his earpiece.
More coffee for you, too.